Hot summer day, Anna and Mary were on their way to an asthma club meeting. Asthma is an airway obstruction which is partially or completely reversible either spontaneously or with treatment. When their friend George asked for a ride, as soon as he stepped in the car, he instantly smelled Mary's strong scented perfume. At first, he thought nothing of it, but he eventually started coughing and sneezing and felt a tickle in his throat. Anna and Mary were growing concerned because they heard wheezing. Wheezing is a high-pitched whistling sound made while breathing. George struggled to answer as he was gasping for air. Little did they know he was having an allergic reaction to Mary's perfume. Anna decided to make a sharp turn, just headed to the nearest hospital. By this point, George was hyperventilating. Hyperventilating is a rapid and deep breathing, and he started to show signs of cyanosis. Cyanosis is bluish skin color due to decreased amounts of oxygen. Since Anna was in a panic, she wasn't paying enough attention to her surroundings and started speeding. While approaching a busy intersection, Anna realized too late that the light turned red and collided with another car. Mary was quickly ejected from the car since she was not wearing a seatbelt. While Anna and George remained in the car with multiple injuries, EMTs shortly arrived, but by this point, George's airways were closing, so they administered epinephrine. Epinephrine is used for emergency treatment of severe allergic reactions. They also established a temporary airway using an NPA. An NPA is a nasopharyngeal airway, a flexible rubber tube which goes through the nose, ends at the base of the tongue. Since Anna was driving, the force of the collision caused a broken rib to puncture the lung. This is called a traumatic pneumothorax. It is a severe condition that results when air is trapped in the pleural space under positive pressure, displacing mediastinal structures and compromising cardiopulmonary function. When George arrived, the emergency airway was removed and he was put on a non-rebreather. A non-rebreather is a special medical device that helps provide you with oxygen in emergencies at 10 liters a minute.
The RT did a full assessment and quickly drew an arterial blood gas. An ABG is a blood test that requires a sample from an artery in your body to measure the levels of oxygen and carbon dioxide in your blood. The result was respiratory acidosis. Respiratory acidosis is a condition that occurs when your lungs can't remove all of the carbon dioxide produced by your body. This causes the blood and other body fluids to become too acidic. So he remained on a non-rebreather until he was stable. On the way to the hospital, Anna had a trach shift called tracheal deviation. Tracheal deviation is a clinical sign that results from unequal intrathoracic pressure within the chest cavity and was experiencing symptoms of pleuritic chest pain. Pleuritic chest pain is located laterally or posteriorly, sharp in nature, and increases with deep breathing and tachycardia. Because of the extreme pain, she was also experiencing episodes of dyspnea. In the emergency room, the RT immediately noticed the shift in her trachea and began to assess. An ABG was ordered stat. A chest tube was inserted at the fourth intercostal space in order to help remove air and allow re-expansion of the lung. While doing chest palpitations, the RT heard decreased vocal and tactile fremitus. Shortly after, a chest radiograph, which produces images of your heart, lungs, blood vessels, airways, and the bones of your chest and spine, was performed on the lateral side of the pneumothorax. While being transported to the hospital, Mary was unable to feel or move her legs. Upon arrival, it was announced that she severely injured her C3 vertebrae, causing paralysis of her arms, trunk, and legs, making her quadriplegic. A chest x-ray was ordered to confirm the injury to her vertebrae. After surgery, the doctors informed Mary that she was in complete paralysis of all four limbs and the muscles that control her breathing, such as her diaphragm. Mary was going to be vent dependent for the rest of her life.